three main functions of the female reproductive system are to make and store eggs, or oocytes, provide a site of fertilization, and protect and nurture the fetus as it grows. But even after the baby is born, the female reproductive system is in high gear to feed the newborn. The topic of this video is the anatomy and physiology of the mammary glands, the structures that produce milk for the newborn baby. When classifying the structures of the male and female reproductive systems, I used the categories of essential versus accessory organs. Then, within the accessory organs, there were ducts, supporting structures, and glands. And mammary glands are accessory structures in the female reproductive system. If you look closely at this diagram from the book, you'll notice that the mammary gland structures are superficial to the pectoralis muscles, which are shown in pink here. Mammary tissue is known for having a lot of adipose tissue, or fat, that's shown in yellow. Now, the main milk-producing structures are these alveolar glands. Mammary glands are always there in females, but really develop in puberty when the alveolar glands get bigger and more fat is added to this area around the alveolar glands. In addition to the alveolar glands, there are a series of ducts that move the milk out of the breast into the baby. Now, when the milk is released from alveolar glands, the milk travels through these alveolar ducts right here, and then several alveolar ducts come together to form an ampulla, so it's slightly thicker right there. Now, from the ampulla, milk travels through lactiferous ducts, right here where the ampulla thin out again, to the nipple. And there are actually openings on the surface of the nipple that let that milk out. One thing that many people don't know is that there are many alveolar glands, and each one of those makes milk. And then with all of the ducts that take milk to the surface, there are actually many tiny openings on the nipple surface. And most people imagine the nipple as having kind of like just one opening, but that's not the case. From a form follows function standpoint, it's good to have many openings so that if one gets clogged, milk can still get out to feed the baby. Some other cool form follows function properties of the nipple are that nipples are made of erectile tissue, so it's easier for the baby to latch onto and get milk into its mouth and digestive system. And also, the pigmented area around the nipple is called the areola, and during pregnancy and in the time after pregnancy, pigmentation actually increases in the areola and on the nipple, and that helps the newborn baby better see the area that they need to latch onto. Since we've talked about other cancers in the reproductive system, I wanted to mention breast cancer. Breast cancer is the most common cancer in women, affecting about 1 in 8 women in the US, with about 1 in 35 women actually dying from breast cancer. Like other cancers, the earlier breast cancer is caught, the better the chances for treatment. Unfortunately, a lot of women get embarrassed or nervous about the test for breast cancer. The easiest way to screen is with a self-exam. So this means that women have to know what their bodies look and feel like normally. And in a self-exam, a woman can press around and feel the breast tissue to try to feel any lumps or any other abnormalities. And this is easy to do as a normal part of showering. But a self-exam definitely won't detect all breast cancer. Instead, it's recommended that women start getting clinical exams like mammograms starting at about the age of 40 and going like every other year from there, and then even earlier if there's a family history of breast cancer. So here's a picture of a mammogram up here at the top. It looks, and from what I've heard, feels very uncomfortable. Now, what a mammogram is an X-ray picture of breast tissue. And to get the best image, the breast tissue has to be kind of like flattened out, and that's the uncomfortable part. But detecting breast cancer early is a good payoff for that discomfort. Now, if breast cancer is found, common treatments include chemotherapy and radiation therapy, and even a mastectomy. So a mastectomy is a surgery where the breast tissue is removed, and women can have one breast removed, or a double mastectomy where both breasts are removed. And in this picture, the left breast was removed, but it's really common for women to have breast reconstruction surgery after a mastectomy, and that's where a breast implant is put in the place where the breast tissue was removed. And in the case of breast reconstruction, the surgeon can actually cut around the nipple and leave the nipple so that the nipple can be sewn back in place during the reconstruction. I've already mentioned the changes in the mammary glands that happen with puberty, where the alveolar glands get larger and more fat is deposited around the mammary tissue, but there are additional changes that happen during pregnancy. First, the alveolar glands get even bigger and there's even more adipose tissue deposited. But what I wanted to show in this picture is that the branching inside of the alveolar glands gets more extensive too. Now, this increased branching creates more surface area inside of the alveolar glands for all of these milk-producing cells that are in blue here that line the alveolar glands. More cells means more efficient milk production for the baby. From a practical standpoint, many women increase their breast size by about 2 bra cup sizes during pregnancy. And all of these changes happen in less than 9 months. That's the length of a typical pregnancy. Now, the relatively rapid growth and increased weight of the breast tissue can strain the skin on and around the breast. So right here where the breast kind of attaches to the rest of the body, and that can result in stretch marks on the skin that a lot of women worry about. And to try to prevent this, some women choose to wear a bra at all times for extra support during pregnancy. Once a baby is born, it is time for breastfeeding, and studies have shown many benefits of breastfeeding. Whether or not a mom wants to breastfeed long term, doctors always advise that moms feed their baby the very first milk, which is called colostrum. Colostrum is packed with antibodies that pass those antibodies from the mom to the baby, and studies actually even found antibodies against COVID-19 passed from the mom to the baby through the colostrum. So think about colostrum as kind of like a head start for the baby to prevent infections while the baby's immune system has some time to develop. Now, in addition to the immediate benefits of colostrum, a lot of studies have shown that breastfeeding can decrease the incidence of other conditions later in life, such as a decrease in allergies, decrease in gastrointestinal problems, and even decreased chance for obesity and diabetes too. In addition to the benefits for the baby, breastfeeding can benefit the mom as well. First of all, breastfeeding can create some quiet bonding time between the mom and baby. Furthermore, many women are eager to lose the weight that they gain during pregnancy, and breastfeeding can help with that. Interestingly, studies have even found that breastfeeding can decrease hypertension, high blood pressure, and reduce the chance of breast cancer. And one of the biggest benefits, however, is that breast milk is a portable source of food. So moms wouldn't have to carry around a cooler or a container for formula or breast milk. And breast milk is cheaper than baby formula and could save a family more than $1,000 per year. Of course, there are some trade-offs to breastfeeding as well. Breastfeeding moms have to watch what they eat and drink, as that can be passed on to the baby, including prescription medications. It can lead to discomfort in the breasts and even take away time between dad and the baby. And with breastfeeding, the milk needs to be taken out every few hours. So breastfeeding moms that work have to use a breast pump, and whether pumping or actually breastfeeding, the process can take a long time. Often like 6 to 10 times per day, breastfeeding or pumping with an average of about 20 minutes each time. And if you do the math, that's a big commitment. Finally, mammary glands can get infected if bacteria finds its way backwards, from the nipple through the lactiferous ducts, ampulla, alveolar ducts into the alveolar glands, and cause a painful infection called mastitis. So, even though there are some potential drawbacks to breastfeeding, most doctors recommend breastfeeding for families that can work through it.